If you haven't shared this page with your family, friends, or even those that really need this information, Nesha Medical Talks, it's all about sharing a conversation that could change a life merely by providing information. I'll be your host, Ilka Platt, alongside our very well-known general practitioner and the founder of Nesha Medical Practice, Dr. NelsonMakemba. Welcome.
Thank you very much, and I'm excited to be here.
1 month away from the end of the year.
Yeah.
It's almost done.
It's almost done, and it has been an excellent one indeed.
Yeah.
So we're looking forward to the coming one.
It has been.
Yeah.
It has been.
Yeah.
So for those that might find themselves in the hospitals, when a loved one needs to have medical procedures done, our topic for today is about informed consent. Very important. Sometimes we don't understand. Sometimes we don't know the fine T's and C's. So we're going to unpack that on this episode. Let's start with the basics. What are we referring to when we say informed consent?
All right. To simplify the question, actually, it's a very important question. Informed consent, as it stands for, it's an individual consenting to a procedure, a medical procedure in this case, with an understanding of what's going to be done. Therefore, the word informed consent. Previously, what we used to do, we used to just get consent from the patient. It might not necessarily be informed then, but consent was just consent. Yeah. So, and then what ended up happening over the years, medical legal issues comes up. You do a procedure on a patient, although they had signed the consent. 2 years, 3 years down the road, they might come back and say, "Doc, but I didn't understand what I was signing to." So we realized litigation was becoming a problem in the medical fraternity. Therefore, consent was revised to then become an informed consent. In other words, you sit down the patient, you explain to the patient what is going to be done. And also explaining to the patient what's going to be done, you have to include all the pros and cons, advantages and disadvantages, the risk involved with a particular procedure, and the outcome of the procedure, depending whether you are going to restore functionality in its full entirety, or you might do a procedure that might be life-saving, for instance, but it might not necessarily restore the entire function, depending on the procedure. So these are the kind of things that you sit your patient down with and you sort of discuss with the patient, so that when they sign, they are literally saying, "I'm signing to everything," including, the risk of, if things don't go according to plan. So that if that happens, at least we get to protect ourselves also as clinicians. I tell you, medicine is an exciting field, but unfortunately, it's also a space where we get the 99 things right. And the one thing you don't get right, the whole world comes for your head. So the informed consent is also not only geared at also informing the patient and helping them understand, but also to protect us. So that if I do a procedure on a patient and if things don't go as planned, I will then come back and say, "But we explained everything." The individual understood the risk involved before they consented to the procedure. Therefore, they cannot come back and, litigate me, As long as I've done everything reasonably well, that any other competent doctor would have done, and things do happen even under, the most competent, most experienced end. Complications unfortunately happens. Things don't always go our way. And this is what informed consent seeks to address, to make sure that all parties involved are protected if things don't always turn out the way we expect.
And that's what makes it difficult, Doc. I mean, we sometimes assume somebody can sit and give consent, but some people it's life or death.
Yeah.
They can't even speak. They can't even write. They're not in the mental state to even do that. How do you deal with such special situations?
Yeah, the special situations oftentimes involved in an event. Let's say a procedure has to be done, but the patient that is involved might not consent to it. Maybe their level of consciousness is diminished. So we have medical superintendent, for instance, the manager that is in charge of the hospital, can then consent on behalf of the patient to say this is a life-saving procedure. The patient is, however, not able to consent themselves. So a medical superintendent can consent to that. And then when the doctors goes in, and if anything happened, at least, there was somebody senior, or at least, at the management level that was informed about the procedure, and also just involving, the third party, meaning the family. If it's a couple, you talk to the spouse. If it's a father, a mother, at least the children are informed. So in an event, the individual themselves can't consent, at least we have that, leeway to, move around, and have, somebody else consent on their behalf. Yeah.
Two folds of the question,
Yeah.
patient's interest and also the healthcare provider.
Yeah.
What's important for patients to know, understand, the fine T's and C's? What are those things that they should look out for in that document?
Yeah, when an individual is going for a procedure, depending obviously on the type of a procedure that is done, first and foremost, are we going to, do a procedure? We are going to remove something. Are we removing an organ or are we removing a body part? So that's the first thing you ask. Are you able to function effectively and live without this? And if a complication arises from the procedure, what are the consequences? And, does that mean you will no longer lead a normal life? Does that mean that your ability to function will be compromised to an extent? And once that information is provided to you, then you make a decision. Now, to be specific, I can just give an example, for instance. Let's say I have a mommy who has 4 children, and she has had 4 cesarean sections. We know that it's probably not advisable for her to go for a 5th one, because if she falls pregnant and the uterus has been, cut a couple of times, she can even develop a uterine rupture, it's from the time that she turns, 5 months of pregnancy when the baby is not ready, and that places her at risk, and the little one. So what then do happen is that if I'm going to do a cesarean section and it's the 4th one, I'll then explain to the mother that, beyond this one, it's probably not advisable to fall pregnant again. And for us to make sure that doesn't happen, we can do a tubal ligation where we close off your tubes. You can still enjoy, being sexually intimate with your partner. Just that the eggs are not going to come down to the womb. Therefore, you won't fall pregnant ever again. But then that need to be explained properly. And she need to now sign and say, I do understand that, this is it. After we come out of theater, no more babies.
Yeah.
Yeah. Because, to further, explain why I'm saying this is because we have had incidences, for instance. A mommy comes in, we have had a sad story, of a mother who had given birth to 3 children, all by cesarean section, and she did a tubal ligation after her 3rd one. And then one day she sent off the children to go visit, their grandmother at a farm. They were playing in the field, and there were these little berries growing on the trees. They were poisonous, and the kids grew up in the city. They didn't know the difference, so they all ate those berries and they all died.
Wow.
Now here's a mommy. Her tubes are closed. She can't fall pregnant anymore. All her 3 children are gone. Now, just imagine if you had closed those tubes and not explained the implications to her.
She would have sued you.
Yeah, no,
she would have sued
She would
you.
have said, look, I want to have kids now. I lost all my kids.
Yeah.
But at least it was explained to her. She understood. Yeah, those are the kind of, gray areas that we tend to run into, having used the cesarean section versus BTL, just as an example.
Yeah.
But there are many incidences, even going and taking out an appendix, for instance, in as much as that we don't really have much of functionality of it. Some, literatures might argue there's immune protection. If you take out an appendix because it's inflamed, and if it's ruptured, it might cause more infection and kill you. If you don't explain to the person the implication of what you're doing, even also at times we might just find people just wanting to make a quick buck out of the system. So look, these guys took me to theater. I wasn't told what's going to happen to me. Therefore, I need now 5 million for the procedure that was done because I'm not happy. So the reason why we take informed consent is so that we have this documented, is on file, so that if a patient also turn on us, 2 years from the time of the procedure, we can just then pull out the file and say, but you said to this. We sat you down, we explained everything to you, and you did understand, and you are in a mental state to consent to it. And in an event where they are not able to, then we involve either the superintendent, we involve the family, or even a commissioner from the police. Yeah, so that it becomes, a legally binding document, so that, years from now on, if you want to come and take me on, I just pull out the paper and say, but
you've got the proof.
Yeah, I got the proof. That I just didn't make my own decision without letting you know what's happening.
And that brings us to the concluding, remarks. As healthcare practitioners, what are the things that we need to make sure that we iron out? You said, yes, inform have that consent, have that legal backing. But for those that just enter into the industry of the medical industry, what would your final concluding remarks be towards the health sector?
Yeah, especially surrounding the aspect of informed consent. First and foremost, always use the language that the patient can comprehend the most. Because if somebody comes to you and they said, look, my English is limited, I would rather than consent through a translator. Or if I'm able to speak the language, I do speak to the patient in the vernacular language that they can understand. And then I'll then ask them questions, do you understand what this is all about? And obviously, if you are a bit worried that this might turn out otherwise, because we are human beings. When we interact with patients, we can pick up on personality. Somebody might walk into the clinic or into a procedure room, and already they may be giving you those vibes that this is the kind of a person that can come back 2 years from now and say, but I wasn't told really what's happening. So have a third person also to be with you while you're explaining the procedure. Make sure the person understands so that if they turn around, and obviously with, the devices that we have, if you are really worried, some of informed consent, you can record the session, and you can file that recording, to say, look, this is me explaining to the patient. I have it on record, paper, audio, visual, whatever the case might be. Just in case, things turn around, I should probably highlight, these things are not so much of a major problem still in the developing world. But the developed world is far ahead of us. Their doctors, get taken to court almost on a daily basis. Just a simple thing, the person will go tomorrow and claim and say, that doctor gave me an injection, and since that day I got this pain in my leg that's not going away. Now, pain is subjective. There's not really a modality in measuring. The person is claiming there's a pain, but you don't really have a yardstick to measure the pain. It might just be a story that they are making up, and now they want to make a bug out of you. So that's why you probably need to, even when you give an injection, when you draw blood, for instance, if you are looking at things like, cancer, HIV and all that stuff, you need to explain to the patient what you are doing. Because if tomorrow the result comes out and is otherwise, not so good, and then you give it to them, they might turn and say, but you know what? I would have been better off not knowing that I have this problem. You draw my blood and not told me what you were testing for. Now you are telling me I have this disease. So this is now emotionally traumatizing. I'm depressed. I can't sleep. I'm not able to function at work. So you owe me 10 million for that.
Wow.
So these are the kind of, gray areas that are in the medical profession. And obviously to our young colleagues also that are entering the profession, just take your time. There's no need to rush. And if you're not too sure whether the person understood what you tried to explain to them, have them come back again and then repeat it again. And then on the second time, if they say, look, the messages, come across, then you can go ahead and do the procedure.
Sure. Doc, you do such a great job. You and the medical healthcare system, a lot of challenges still, but thank you for shedding light. I think that was very important to really understand that. And wishing you all the best.
Yeah, thank you very much. And we look forward to more conversations.
There we go. Any comments, any opinions, please feel free to post it on the YouTube channel. And we will be back with our last episode for the year. That's next month.